Okay, so I want to show you some basic things that I have almost all my clients do, especially if there's something off. We want to see how the whole body's moving. And I'm going to go through about four or five different motions. I want to see how they are on you, left versus right. So you can follow along. It should be simple to follow. I'll try to make it as best of a description as I can, and you can kind of follow through this. And this is a good way you can kind of do this as your home program. So basically, first thing is this. You want to assess left versus right for all these motions. So the first one I'm going to go through is an arm raise. What you're going to do is just check out your arm. You're going to bring it up and up, back, back, back. Go as far back as you feel like you can go and get a feel for that. Really feel out how that feels. You know, if it's tight or it's stiff or whatever, like where I'm feeling like some kinks or anything restricted, bring it down. Do the other side. And then I can tell right away, this side's tighter. I'm feeling a little kink in my shoulder blade. So that's tighter. And this all just gives us information on how our body is aligned or not aligned, okay? So that's a good thing to kind of take a look at. And obviously, if anything's too uncomfortable, keep that in mind. But we're trying to decide which side feels better, which side feels tighter, okay? And then the next one is twisting left and right. You're gonna twist as far as you can to your right, come back, twist as far as you can to your left. Okay, right there, left is a little tighter for me. So I'm finding that my left twist and my left arm raise are tighter, okay? And oftentimes, if you have something that's very off with either of those, arm raise or twist, we might just treat with just those two. But we're gonna go over a couple other movements. I wanna see how you do here, okay? So first of all is this. We're gonna do a leg raise. You're gonna put your leg out in front of you. Knee stays straight. I'm kind of scooped to the edge of the table, and I want my heel on the floor. And what you're gonna do is lift up and lean back. You're gonna go back as far as you can go, trying to bring your thigh closer to your belly. And then do what you can do. If you can't go that far, don't worry about it. Just see if you can do it. And if it's a no-go, it's a no-go, that's fine. Next thing is this, you check the other one. And what I'm doing is also seeing visually up the wall, kind of how high I can see my foot, like seeing where I am if I'm level to a certain level. So that way I can tell, okay, I can get up this high with this arm or this leg, and then this high with this leg, so a little tighter maybe on my left again. Okay, so there's those three. And then the last one is a sit to stand. So you pick your foot up, you stand up, and then you sit back down. Try to balance and see how you do. And then the same thing here, up, and then back down. I'd say on my right side, it's a little more wobbly. Okay, with that, that's our testing, and we kind of see what we're doing. There's actually one more too. You can do a single leg stance and balance. So you stand here, bend the knee, test that one, and then stand on one foot again, bend the knee. I'd say I'm a little off standing on my right leg, okay? With all that, we figure out which of all the movements, arm, twist, leg lift, sit to stand, and the toe reach, which of those has the biggest difference between right and left, okay? And then from there, what we're going to do, and we're just gonna pick one. For me, I'm gonna say it's my twist, okay? And most people, if you have a twist that's off left and right, it's a good place to start. What you're gonna do is you twist to, let's say I'm tighter on my left, that feels tight. Right side feels okay, okay? What I'm gonna then do is I'm gonna do the twist to my right side, and I'm gonna let my legs move however I want them to. I'm gonna twist to my right, come back, twist to my right, come back. Keep going, just doing a bunch of twists here, okay? And as I get done, usually gonna have you do about 10 or 15 or even 20 of these to one side. As you get done with the twist to the right side, I'm kind of trying to wind up my body, and I know it's counterintuitive, but when I'm working to the easy side, it's unwinding the other side tightness. And so I'm working to the easy side. It's not a misnomer, it's basically what I'm trying to have you do. That's why it's counterintuitive to what most people have been taught to do. And then I come back, so I don't know how many that was. Look at the video later and see how many it was. But you're just gonna do a good dosage of exercise. I'm only gonna do one set for now, just so we can speed up the video. But basically, you know, working to the easy side, and then we're gonna come back to the tight side. Okay, and then we're gonna come back over here. Okay, I could say that I still feel a little tension, but I feel like I can go a little better. And you'll probably be able to see on the video better than I can see right now, but I feel like I got a little more range going that way. And that's the concept. And then basically from there, we're gonna do the easy side to fix the tight side. And I know that's kind of counterintuitive, but it's what I've learned for over 15, 60, I don't know, it's been a long time since I've learned this technique. I find it very, very quick to balance out the body. And the more we can get all these movements, the arms and the leg raises and all those things to balance out, then things get better and better. And then we can kind of work on the other things, like, you know, getting into a more functional squat pattern, maybe lunge patterns, all those different things play into that. But these movements were picked deliberately because they encompass, you know, upper body, trunk, hip and leg, and then also hip balance and weight bearing. All those things are encompassed in that routine, and we find a good way to screen how the body's moving and then give you some quick wins, especially with the easy side twist. We call it, you know, yummy and yucky. Yummy side to the right, yucky side to the left. We use the yummy side to fix and help the yucky side. Go ahead and give it a try. I find if they stick with it and they have the right guidance through this, it works wonders. People feel so much better, and that way you can kind of move on to your other routines, because once our body's more balanced, then we can start doing those other things and get the body moving much better. So hopefully that's helpful. Give that a try, and thanks so much.